Welcome back to the Saudi Morning Show. That was our Facebook, email, and Twitter, so please let us know what you think about this segment. And our eyes are one of the most important tools that we use every day. Some people seem to neglect it and oversee how useful and how necessary it is. And as simple as that can be some of the dryness of the eyes or injuries can disrupt our everyday life. Our next guest is Dr. Zoelfigar Mohammed, which is a senior optometrist. So welcome to the show, Dr. Zoelfigar.
Welcome.
And a lot of the issue that's seen to have in the kingdom is a lot of people have to have dry eyes. And can you please tell us, sometimes when people get the dry eyes, what is it? How do they get it?
Okay, before I speak about dry eye, we must know what is a tear film. The tear film is the layers in front of our eyes that compose of tears and oils and mucus. This tear film nourishes the anterior segment of the eye, which is the cornea, and prevents the eye from the dust from any foreign bodies and protect from the bacteria. This secretion comes from the lacrimal gland in the upper of the eye and from the pneumobian glands, which secrete oil and mucin from the goblet cells from the conjunctiva. These layers, one layer is oil. Oil prevents these tears from evaporation. And from evaporation from the environment. Another layers, our second layers is tears layers. Last layer is mucus layers. Any deformity in these layers becomes the quality of tear is not good and may be dry. The dry eye causes maybe from less of secretion, maybe from the environment, maybe from medications, maybe from some inflammation or some disease. All these factors maybe got the eye to be dry.
Indeed. And Dr. Zoelfigar, if we talk about the dryness of the eye, how it is that we can understand? Maybe some people have always had a dry eye, that they don't even know that this is something abnormal or not normal, because they never really felt how it is to be having, like, you know, any other feeling than the dryness of their eyes. And when we talk about the dry eyes, how is it that we can understand maybe that we are having dryness of the eye? What are some of the symptoms through which we can feel it?
Okay, the symptoms of dry eye is different. Number one of these symptoms, grittiness, some grittiness or sensation of foreign body in the eye.
Without having a foreign body.
Yes, hotness, irritation, sensations of fluctuation vision. Sometimes see good and other times see not good. This evidence of dry eye. Another thing, a very important thing, sensation of foreign body, and this is the main complaint of patient here. I sense something in my eyes. That is the evidence of dry eye. Dry eyes may be, as I said, according to the causes. Dry eye sometimes related to disease, maybe systemic, maybe ocular disease. Ocular disease as keratoconjunctivitis sicca syndrome or dry eye syndrome. Systemic as Sjogren syndrome. There is dry in the all, swell in the body, swell and tears and another things, rheumatoid arthritis. This may be caused.
Rheumatoid arthritis.
Yes, rheumatoid arthritis may be caused of the dry eye. In the first, I said medications. Medication, antihistamines. Antihistamines may be cause of dry eye. Anticongestant and steroids. All these may be cause dry eye. I ask the patient about his history, family history and patient history, and after that I understand this is dry eye or not.
Okay, and a lot of the people say around the world they wear contact lenses, and here in the kingdom it's sometimes very bright outside. Where when they wear the corrective lenses, which is glasses, they don't feel comfortable because then they have to wear sunglasses, and a lot of them they wear contact lenses. What kind of causes can that cause for dry eyes?
Okay. Before that, anybody need to wear contact lenses must be do routine eye examination for contact lenses.
Routine eye examination.
Routine eye
examination.
Yes. Ask about history, ask about general health, ask about, and after that I check the outer eye and inner eye. After that I understand this eye is good for good candidate for contact lenses. If not, I tell the patient about the cause of contraindication of contact lenses. With contact lenses may be risk factor with dry eye. Patient wear contact lenses because contact lenses rest on the front of the eye and reduce the space of tears. As I said, tears is very important to nourish the cornea. I mean, 90% of nutrition for the cornea from the tears, oxygen from the tears. If there is something in front of the eye, maybe affect the other things, the epithelium of the cornea may be affected by the contact lenses. Other things, contact lens may be reduced sensation of the cornea, and that led to decrease secret of tears.
Indeed, but also tell us, Dr. Zoelfigar, could maybe watching television for extended hours or using the computer for extended hours also lead to dryness of the eye?
Okay, computers is one of the risk factors for the dry eye, because somebody sitting in front of computer and stare all the time and not blink, because anybody must be blink more than 16 times. If we see the computer or concentrate on the computer, we will not blink normally. For that, the tears is evaporated.
And a lot of people that they're in front, they have an office job and they're in front of the computers. Do you recommend them to use contact lenses, or do you recommend them to use glasses?
I recommend them by use glasses, because if you wear contact lenses, this is the risk factor of dry eye, and another for that the computer is the risk factor of dry eye. For that there is two risk factors. It's very difficult. For that, anybody in front of the computer, I advise him by use eyeglass.
Right, and also Dr. Zoelfigar, tell us a little about moisturizing the eye, let's say with artificial teardrops. Now, lots of the people we get to see, because they feel dryness of the eye due to the weather maybe, they straight away head to the pharmacy and they buy teardrops without being advised by a doctor. Is it advisable to use teardrops without being advised by your doctor, or should you speak to your doctor before you use it, and do they actually help?
Okay. Firstly, if you feel dryness, or if you feel some one of these complaints I said, you must go to the doctors, or to the optometrist, or to the ophthalmologist to check your eyes and to study the cause of the dryness. And after that, we choose the treatment of the dryness. Maybe artificial tears, as in pharmacy, or blinking exercise, or reducement of the causes. The treatment of dry eye depends on the cause of the dry eye.
Right, but could dry eye be a serious condition of the eye? For instance, let's say sometimes they say for a person who's diabetic and he doesn't know that he's diabetic, maybe constant trips to the restroom and weight loss, gradual weight loss, could be one of the early signs that the person is having diabetes. For dry eye, is it a sign of maybe a bigger eye disease sometimes as well?
No, dry eye generally is a sign. Is a sign for something.
For something like
Maybe, and diabetic patient may be dry eye.
diabetic patients may also have dry eye.
Have dry eye. As I said, it's, rheumatoid arthritis, and all this is some signs of this disease, dry eye. Maybe systemic disease and maybe ocular disease.
And what are some of the ways that obviously it's like when you have dry eyes, it means something it's unnatural because your eyes has to be lubricated properly. Whether it's like from very dry outside to watching the TV or computers a lot, what kind of long-term effects can they have on your health regarding with the dry eyes? What kind of complications can it lead to?
There is no known big complication, small complication. But sometimes this complication may be go to be ulcers. Ulcer in the cornea. Ulcer is big problem. But before that, there is no big complication. For that, anyone sense these symptoms or this complaining, go to the doctor to say to you what is the cause of this problem.
And you mentioned something like I heard about a corneal ulcer. Is more common in people that wear contact lenses, which also can increase the bacterial infection in it because there's a space that can start between the eyes and the contact lens, and the dryness can also affect it more. What's your input regarding that?
Corneal ulcers, as I said in the first, the cornea have first layer is epithelium. The epithelium is between the tears and the cornea. The corneal ulcer is start in the epithelium due to, as you said, infection, contact lenses, any trauma, any something. For that, ulcer is treated by any treatment if not go to the opacity. If the opacity is big problem and need corneal graft.
Right, and also Dr. Zoelfigar, we see lots of the people have LASIK eye surgeries as well for the correction of the vision to sometimes for some medical conditions that they may have. Could LASIK lead to dryness of the eye? Could it be one of the negative symptoms of having a LASIK surgery previously?
Any doctors go to do the LASIK surgery or any surgery must check the tear film or the tears. If tears is enough, after that go to the LASIK surgery. The LASIK surgery is affect epithelium of the cornea. If it's affect epithelium, that means reduce sensation, some reduce of sensation of the cornea. Reduce of sensation lead to reduce the secret of the tears. For that there is some dry eyes. For that any doctors care by these problems and gives the patient artificial tears.
Indeed. And now you mentioned about LASIK that it could be one of the reasons for dryness of the eye. You also mentioned using your computer or television for long hours where you would be concentrated so much that you would not be blinking as much as you normally would. But as we talk about the dryness of the eyes, could sun be a factor too? There are lots of people who go out in the sun yet they would not be wearing sunglasses. Could that be a cause of dryness of the eyes too?
Yes. Outdoors in the dry climate must wear sunglasses to reduce the evaporation by the climate earth. Or in the rooms we must increase the humidity in the rooms.
That means humidifiers or any water source.
Yes, okay. Because air conditions dry, because some weather is dry, go to the patient to be dry eye patient.
So will you recommend a lot of people in a weather like this, because it's very dry almost year round, do you recommend them to use contact lenses or try to avoid it altogether?
No, don't avoid, because contact lenses sometimes may be optional, sometimes may be must. For that, I have more than one types of contact lenses. In soft contact lenses, people who wear high water content, I said to him, wear low water content.
Okay.
Because contact lenses with high water content need more water. For that, I advise him to wear low water content, or go to the rigid glass permeable lenses, and go to the lens not need more water.
Okay.
And it's difficult, I said to patients, don't wear contact lenses, because contact lenses sometimes, as I said, must for the patient keratoconus, for the patient high errors for food.
Okay. And for the viewers at home that they're wearing contact lenses, do you recommend them to have like eye drops with them all the time, or just put it like once a day?
Don't use artificial tears continuously, according to complaint, and don't wear continuously, because this may be big problem, maybe reduce the secretion of tears from the eye. For that, you must use it from time to time, not systemically, because big problem.
So your eye might naturally from the inside feel that it doesn't need to produce any extra tears, because your eye is already lubricated with this external source of lubrication that you're constantly putting to your eye. So your eye might naturally actually stop the formation of as many tears as are needed, and it might lead to chronic dryness of the eye.
Yes.
Indeed. And this is one of the reasons that Dr. Zoelfigar is discouraging you from going just to the pharmacy with your choice and buying the tears. You have them once it is recommended by your doctor. So for anybody who is living in dry climate like Riyadh, cannot just go to the pharmacy, buy those tears and just keep it with them just in case if they feel the dryness of the eye.
Advise all the viewers, if you feel without feeling of dry eye, must wear sunglasses on the outdoors. In the doors in front of the computer and television, must blink regularly.
Must blink.
Okay.
Regularly.
Are there any other kind of eye exercises? Like for instance, there are some exercises for the eye where they say you focus only on one point and you keep looking without blinking. Then you close your eyes. Then you open it again and then continue to stare at the same focal point for another 2-3 minutes and then blink your eye, so that this would, help the muscles of your eye, and it's kind of an exercise for the eye, or to be moving your eye all around, so up, down, right, left, and then you go clockwise and anti-clockwise, and all those exercises, do they help? Or
This exercise related to orthoptic or binocular vision, if there is problems in muscles.
Okay.
But the exercise I said for blinking, ask the patient to look at the computer and see the screen and blink 16 times at a minute.
In a minute.
Yes.
A lot of say the viewers at home, they have this office work, or they just sit all day and they're not sure about whether to keep it bright or dim. What's your opinion on that? Because sometimes if it's too bright, they feel like it's straining their eyes and they feel like more dry of it. Like, what's your opinion on that?
Daylight is good.
Like make it bright or keep it in the middle, somewhere in the middle?
In the optics we say daylight, I mean, not bright light, not dim light, because dim light is big problems.
Okay.
For that. In addition to causes of dry eye, older patient may be one of the dry eye patients. Any patient go to the older, maybe dry eye. Another woman more than men, female more than male, because pregnancy, because any change of hormones, pregnancy, menopause, any of them. For that, if the complaint from the woman, I suggest this is a dry eye more than man.
Is there some things that the people can do at home, like drinking extra water and avoiding this type of drink, to probably help the effectiveness of dry eyes?
Yes. 8 to 9 glass of waters is good. Good for anybody to prevent himself from the dry eye. Good news for caffeine drinkers. Caffeine is good for dry eye, but not more.
So
okay, so we have to do things from the discussions today in the studio. As earlier we had Dr. Intisar who said about the caffeine, that you have to be careful with caffeine. And now here it is Dr. Zoelfigar who's saying that caffeine could also help in moderate quantity.
Yes, but not more.
So it's like a give and take relationship. You can have one coffee in the morning to start your day, because a lot of people, they cannot have a normal day without their normal routine.
Absolutely.
So they're a cup of coffee, but do not decrease it on your morning breakfast. And also, if you're going to go ahead and drink your morning coffee, just go ahead and make sure that you just rinse your mouth after that to avoid any stain and to get that perfect Hollywood smile that people will say.
Yeah, absolutely. And with this, Dr. Zoelfigar Mohammed, we'd like to thank you so much for joining us in today's edition of the program.
Thank you.
Yes, thank you, Doctor. I'm sure a lot of the viewers at home will better understand why they get their eyes dry too many times, especially whether in the Riyadh or in the Kingdom. Thank you so much.
And well, so we were speaking with Dr. Zoelfigar Mohammed about the dryness of the eye. If you have any questions that you would like our expert to be answering, you can write to us on our email. You can get in touch with us through Facebook as well as through Twitter. And let us know if you have ever suffered through this difficult time as you would be having the dryness of the eye, and what happened once you visited the doctor. If you have any questions, feel free to send those to us. And if you have any solutions that have worked for you, share those with us in the Saudi Morning Show as well. Let's take a look at our email and social networks. We'll be joining you after that to conclude today's edition of the program.
Welcome back to the Saudi Morning Show. Today's segments we're discussing a lot from healthy white teeth